we're going to do is what? So we're going to look at our patient, right? We've washed our hands, done all that good stuff. Okay. The way to put on a tourniquet is I call it an X. See how that's an X? And make sure you put it tight enough that you're going to see a vein, but not tight enough that you're going to explode the vein, right? I know you're like, well, what does that mean? It's easier to do on a person and explain that to you as a person. Okay, so we're going to feel and decide what we want. We're going to say, okay, there's a good vein. Take off the tourniquet. And go ahead and clean. And how do we clean?
Friction.
Yeah. And inside out, right?
Yeah.
Okay, and then we're going to let that dry. Get your gloves. Again. And this came in your kit, so you guys have this to try on. So we're going to hook up our needleless port with our saline. And make sure you get rid of the air and prime it, right? Okay, anything else you need to do? This. I don't think so, right? I would recommend putting the tourniquet back on real quick and putting on your gloves. Is this clean or sterile?
Clean.
Clean, right? Otherwise we'd be putting sterile gloves. Clean technique. Okay.
The pocket's sterile, huh?
Right, insertion site, absolutely. Okay, so we're going to go ahead, we're going to pull traction,
Taunt.
right? And then we're going to go ahead and tell our patient. We're going to
gonna
stick
feel a
you.
poke.
Going to feel a poke, big stick, whatever you want to say. And then you're going to go ahead and stick your patient. Now I know the IV module kind of tells you to do this weird angle. It doesn't really work, so I would just tell you to just follow what you're going to with the vein. Okay, you can see blood?
Yes.
You guys all see that? So when you see blood, you're going to release your tourniquet. You're going to make sure to hold it. And then you're on this one, you're going to advance and push off at the same time. So you see we're pulling. Okay? Then we're going to go ahead and take our op site.
Did you want that clamped before you started, or did it matter?
It doesn't matter because it's a closed system. See, it's got it here.
Oh, I see it. Okay.
So it's got an end to it.
Okay.
Okay? So now what do we want to do? We want to make sure it works.
Flush it.
Okay? So you can clamp it or you can just pinch it. It's really quicker to just pinch it. Okay? And so you're going to take the top off. Maybe.
Possibly.
There we go.
Wow.
You see that's a good IV, right? Oh, that's great. And when we flush, what are we looking for?
That it goes back in and look at the top to make sure there's no swelling, no edema, no pain.
Perfect. And so y'all convinced we have a good IV?
Yes.
Yeah.
Okay.
Does it matter that this little bit is sticking up still? Doesn't matter?
Doesn't matter.
Okay.
Sometimes we can't get him all the way to the hip. It's a little more difficult on the dummy.
Professor Lisa,
Yeah.
do we document before we put on, or on the arm we document? How do we document the site?
Well, we're going to do date initial time, right? We're going to put that here. And then we're not make sure not to cover up your IV site. Okay? So we have to hook this up to whatever we're going to hook it up, or we're going to tape it because it's a saline lock, right? So if it's a saline lock, we're going to clamp it. And we're definitely not doing any of this, right? Decide what best way it is for your patient. Come over, take your clean tape, and then you can secure it however you want to secure it. Okay, you should be able to see that under there.
Do they do first the tape or just the dressing? Okay, for the IV.
For this kind of IV,
Butterfly.
yeah. Well, this is I don't know what we're calling this one, but anyway, you're just going to put your offside over it. It just depends on the equipment, depends on the hospital, of course. Okay?
Well, you made that look very easy.
Because it can be that
Any
easy.
questions?
We're hoping to get there.
All right, good job, you guys.